members, and I am like, this is not something we have to deal with marks or something like that. It is for our health. It is what we should be doing for ourselves. This, like uh, exchange of ideas would be for mutual benefit. It's not like that it will be helpful for our students or something like that. Yes, it will be, but it is more concerned with our well-being. So I will start. It's 9 o'clock. So I will start. A very good morning to all of you.
Good
Today
morning.
we will be discussing,
Good morning.
and
Good morning,
after
sir.
the end of this
Good morning.
discussion,
Good morning.
I would like to convey that prevention is better than cure. So that is the theme of our discussion today. Now, where did this saying come from, that prevention is better than cure? We had some similar sort of sayings like soap and water cost less than doctor's fees and medicine. Then there is like an apple a day keeps the doctor away. Where there is dirt, there is danger. All these concept of taking action early to ward off disaster isn't new. There was a Latin saying that it is better and more useful to meet a problem in time than to seek a remedy after the damage is done. And this served as a precursor to a much snappier version coined by a Dutch philosopher who coined it somewhere around 1500 AD. Prevention is better than cure. Now, there are two types of people in the world. One who get their car regularly serviced, and the other people like me, those who hear a funny noise in the engine, keep on driving until they need a roadside assistance. So we can divide people into two categories. It's up to us to put in any of these two categories. So as car is concerned, similarly, it comes to our health also. Many of us delay seeing a doctor until we are feeling unwell. But instead of trying to get better once we are sick, it's always better to do what we can to avoid getting sick. Now, there are two reasons for it. Some people do self-medication. Some people think that of the fear of getting some ailment, getting diagnosed some ailment, they say that, okay, if I will get a blood test done, something will come out of it. So it's a fear of knowing something which is not there. So there can be many reasons. But one should not avoid this, because prevention is always better than cure. Now, what does prevention mean? Prevention means preventing from occurrence. We don't want a thing to occur. So this is called as prevention. And there is a very old saying by Benjamin Franklin that an ounce of prevention is worth a pound of cure. So, very old saying. Now, let's come to what basically is prevention in health sciences. Now, if you are able to see, There are three levels of prevention. What are those? Primary prevention, secondary prevention, and tertiary prevention. There are two more types of prevention which I'm not going to deal. One is before primary, it is called as primordial prevention, and one after tertiary, which is called as quaternary prevention. But our discussion today will be limited primarily to primary prevention because it is the one which we should be striving for. Okay. Now, what is primary prevention? It is an intervention implemented before there is evidence of disease or injury. The intent here is to reduce or eliminate causative risk factors. That is risk reduction. Please remember this word risk because I would be using it after some time. Now, what could be the example of primary prevention? Encourage exercise and healthy eating to prevent individuals from becoming overweight. So, what we say is that please do some exercises. Again, I will be discussing this. And we promote healthy eating so that there is no chance of becoming overweight. This is one example of primary prevention. What is that? We want to have a healthy lifestyle in the form of good physical activity and healthy diet so that the individual doesn't becomes fat. Okay. So here, what is the risk factor of becoming fat? Anybody? What is the risk factor of becoming overweight?
There are so many
Junk
problems.
foods,
No, no,
like junk foods.
just concentrating
Problem.
on
Lack of
what I have
What
just
this
told.
means?
No, no,
sir,
no,
no
madam,
physical
madam.
activity.
Lack of exercise.
Yeah, one is lack of exercise. The other,
Sir, eating habits, sir.
Not
eating
eating healthy
habits.
Eating
foods.
habits like
So
junk foods and oily foods, etc.
these are the two risk factors. These were the two. There can be many, as ma'am was telling, but these are two risk factors. So in primary prevention, we want to reduce or eliminate these two risk factors. I hope you are getting my point. This is primary prevention. This is one example of primary prevention. I will talk more about it. So now we know what is primary prevention. In secondary prevention, the intervention is implemented after the disease has begun. And here, what we do is we do early identification and treatment. So if we take the example of overweight, what we do is we check body mass index at every checkup to identify individuals who are overweight or obese. Now, what is body mass index?
Sir, weight
Body,
divided by
yeah,
height meter square.
yeah. Thank you, madam. Body mass index is weight in kilogram divided by height in meter square. As ma'am was correctly telling us, so body mass index is very simple to calculate. We all know our height. It doesn't changes. We have to divide our present weight with the height. And if it is above 25, this means that we are overweight. If it is above 30, roughly, it means that we are obese. So overweight is lesser than obese. So this is if we are knowing this, we check it, we can. So this is secondary prevention. We are identifying early through screening. So getting our weight done is screening. And what we are screening for? We are screening for our body mass index. There is one very simple formula also. What could be the ideal body weight?
Sir,
We
18 to 23.
yeah, please, you can speak, please. Thank you. Yeah,
Sir,
carry on.
ideal body weight for Asians, that is 23, sir. Not more than 23. That is ideal BMI for
Okay.
Indians, sir. Asians.
Okay. What I was going to tell you was, ma'am, ideal is between 18 to 25. Okay, ma'am. So, what I wanted to tell you was, what should be our ideal body weight? Roughly, there is an index called as Broca's index. We can forget the name, but the other thing which I'm going to tell you is more important. We minus 100 from our height in centimeters. For example, if somebody is 162 centimeter, we minus 100 from it. So the ideal weight should be 62 kilogram. So this is another way by which we can know it. This is called as Broca's index. This is called as Broca's index. So this is secondary prevention. Okay. Now what does tertiary prevention means? An intervention implemented after a disease or injury is established. So what are we doing here? We want to prevent any complications because of the disease. For example, we help obese individuals lose weight to prevent progression or more severe consequences. What are the consequences of obesity? One ma'am was telling us about cardiovascular diseases. Yes, it can be the complication. Diabetes could be another complication. So we want that somebody is obese now. What we want, that we don't want that person to develop something worse. So we do some intervention. I give you one other example. In old age, most of us may develop cataract. What will this cataract lead to? Blindness.
Yes.
So by removing this cataractous lens, we are preventing blindness. So this is tertiary prevention. This is called as tertiary prevention. For example, there is someone who has developed polio. So some surgery has been done to lengthen the foot of the person or the feet of that person. This is tertiary prevention. So now we know what are the three levels of prevention. So there is primary prevention, secondary prevention, and tertiary prevention. So in primary prevention, we are doing health promotion and specific protection. What does health promotion means? Healthy diet, better environment, good nutrition, all these are health promotion activity, improving physical activity, all these are health promotion. And the other thing which is equally important in primary prevention is specific protection. Specific protection means we are giving protection specifically targeted to one thing. For example, vaccination. Vaccination is an example of specific protection. Can anybody tell me what are the vaccines which are available for adults? It's just to interact, nothing more.
COVID, sir. Corona.
COVID, very good. Yes, sir. COVID is one example, very recent example. Any other? And please
Hepatitis.
don't call me sir. You know, we are all like, we are just co-learners. Yeah.
Hepatitis.
Hepatitis B. Yes, hepatitis B, as rightly pointed out, is another adult vaccine. Any vaccine more we can come up with?
Tetanus.
Tetanus. Yes, tetanus. It's again a adult vaccine. Any
Yellow fever.
Yeah.
Yellow fever.
Good answer. But when we are traveling to some endemic countries, luckily we don't have yellow fever in India. Any other vaccine? I'm purposefully trying to ask this question.
For measles. For measles.
Vaccine.
For
Pardon,
measles.
sir?
Measles.
Measles usually say it can be given to adults, but it is more for children. Your answer is correct, sir. But
Malaria medicine is now distributed.
I'm
But
But I'm talking about vaccine, madam, and that is tablets. Okay, ma'am. That is also chemoprophylaxis. You have rightly pointed out. It is also an example of specific protection, but I am just discussing about vaccine.
सर अभी
Sir, HPV vaccine.
Yes. Somebody is telling.
वैक्सीन भी रिसेंटली अभी बहुत ज्यादा है
कौन सी मैम?
एचपीवी सर वो
HPV vaccine. Thank you so much.
Rubella vaccine.
Human papilloma virus vaccine. Human papilloma virus vaccine.
Yes.
COVID vaccine is for everyone. Somebody talked about hepatitis B vaccine. It is for everyone. But human papilloma virus vaccine is for females. And
Yes.
this vaccine is being promoted to prevent carcinoma of cervix.
Yes.
So, very important vaccine. Now, just to...
But sir, that vaccine is effective in the age group of 9 to 14 years, not adults.
but sir, 19 is an adult, sir. Hai na?
No, 9 to 14, I'm saying.
No, but we can give it to around 18 years also, sir. Okay, sir. What I'm trying to tell you is that there are now two vaccines which are to prevent cancers. One is human papilloma virus vaccine. The other is hepatitis B vaccine. Okay. Hepatitis B is given to prevent cancer of liver. Okay. We have hepatitis A vaccine also. We will be discussing in our next interaction when we'll be talking about environment and other things. Okay. So this is specific protection. What could be the other example of specific protection? Giving iron and folic acid to all pregnant women from second trimester. Whether she is having anemia or not, we prescribe iron and folic acids. Why? To prevent anemia. We give all children vitamin A drops or syrup so as to prevent night blindness or vitamin A deficiency. So I can go on and go on, but this is primary prevention. Health promotion and specific protection. Secondary prevention is early diagnosis and prompt treatment. Like, for example, the example of obesity was there, but just to for more clarity, we are saying that any person who is having cough for more than 2 weeks, he or she should be investigated for tuberculosis. So this is early diagnosis. We are creating awareness that anybody having cough for more than 2 weeks, the physician should go for a test of tuberculosis to rule out tuberculosis. With this, if God forbid, there is disease of tuberculosis, it should be followed by prompt treatment. Now, what will happen? This early diagnosis will be helping the individual also and the other people also. How? As we all know that tuberculosis is communicable disease. It's a communicable disease. So by starting treatment in this patient, we will be limiting the spread of tuberculosis. So it is secondary prevention. And the tertiary prevention is we want to limit the disability in the patient and also do rehabilitation. So these are the three levels of prevention. And remember, we are talking about prevention is better than cure. So if I ask a question, which prevention could be the best form of prevention?
Primary.
Yeah. All forms of prevention are important at every stage, but we all want that we should not have disease. So primary prevention, as madam said, should be our goal. Now I will talk about some examples of primary preventions, or rather prevention which led to decrease in mortality. Just few centuries back, the sailors used to die because of bleeding gums. And one scientist named as James Lind, he came up with a solution that if we start giving limes to the sailors, these sailors will not develop bleeding. So he came up with the prevention of vitamin C deficiency, because the sailors' diet used to be deficient in vitamin C. And at that time, they used to travel for months and years, and their diet was deficient in vitamin C. This led to their decrease in mortality. And this is how scurvy and or vitamin C deficiency was curtailed. The second example, very recent example of 1854, very close to 1857, which we are so fascinated about. In 1854, there was an epidemic of cholera in London. And many of you might be knowing, there was a doctor called as Dr. John Snow. What he did, he mapped up the deaths and he pointed out that those people who were consuming water from a particular hand pump, the deaths were more. So what did he do? He just removed the handle of the pump. And what happened? There was a declining epidemic due to the people not drinking from that water. And he came up. So people were not knowing about cholera at that time, nor they were knowing about the ill effects of contaminated water. But by this simple observation, he saved so many lives. And you will be surprised that the municipal corporation did not recognize his work. He was rather admonished for this, that no, it is not because of this, it is all other things. But we came up with the knowledge that contaminated water can be a source of death. And many of us might be knowing that cholera is said to be the father of sanitation. Father of sanitation, this disease. So this is again an example of primary prevention. What is this? Anybody? Many of us have
Smallpox.
Yeah, thank you, sir. many of us have a scar on our left side, on the left arm. Many of us have scars on both our hands. Do we have or not?
Yes,
Like,
sir.
this will tell us
Yes, sir.
about our age also. Because then we will know that somebody is born before 1980. This scar will tell us, and this scar is of, one scar is of BCG vaccine and the other is for smallpox. And this smallpox vaccine is a revolution because this is the only disease which has been eradicated from the world. We are luckily a world free of smallpox. And this was just because of Edward Jenner. What did he do? He had an observation. He saw that the people who are handling cows and buffaloes, they developed some wart in their hand, but they did not develop smallpox. So what did he do? He took out the fluid from the wart of these people's hand and inoculated into another person. After some time, he took the fluid from the smallpox patient and he introduced it to the same person. And to his astonishment, this boy did not develop smallpox. And this is how the world got its first vaccine. Can anybody tell me which is the first vaccine which a newborn baby gets?
BCG, sir.
BCG.
BCG. BCG.
BCG, sir.
BCG. Thank you. But here, just to create a lighter moment, the milk of the mother, the
Rich in
initial milk of the mother, which is called as colostrum, this is the first vaccine which the child gets. I'm not saying that BCG is the wrong answer. Please don't think like that. That's a correct answer. But this is the importance of breast milk, the initial breast milk, the colostrum, the yellow milk, it is full of antibodies. So what I'm trying to tell you is that this is how we got the first vaccine. And today, luckily, we are free of smallpox. What is this?
Polio.
Polio drop.
Yeah. Just 10 years back or 12 years back,
Do boon zindagi.
it's do boon zindagi ke. It's just 10 to 12 years back, we were having an epidemic of polio. And now, just because of these drops, we don't have polio. So prevention is always, and remember, we don't have any cure of poliomyelitis. This child would always be on crutches. So prevention is better than cure. Now, this was the first part of our discussion. What was that? We talked about what is prevention, what are the levels of prevention, and I came up with some very good examples of primary prevention, because of which the diseases have been controlled, curtailed, or they have been eradicated. Now, as we all know that diseases are of two types. One is communicable disease and the other is non-communicable disease. In India, we have a double burden of disease. we are still fighting with communicable diseases. On the other hand, we are also facing the problem of non-communicable disease. So we will be discussing both of them. Now, if you are able to see the screen, how a communicable disease is getting transmitted. Remember, man is an enemy of another man. So, an infected person transmit the disease to a healthy person. And there could be various ways of transmission. One could be a direct contact, handshake, or any other contact, by air through sneezing, coughing. This could be in another way. Indirect, by touching a thing which is infected, by consuming food which is contaminated, drinking water which is contaminated, or through some blood which is contaminated. Then we have insects which can transmit diseases, and they can carry infection from an infected person to a healthy person. And then there is a rabid animal which can cause disease in a healthy person. So we have different types of disease transmission. Now, what are the common communicable diseases and what are their most common mode of spread? If you see cholera, typhoid, hepatitis. Hepatitis is jaundice. And here I am talking about hepatitis A. They are all food and waterborne. Whereas influenza and tuberculosis, they are airborne. Whereas malaria could be through a bite of mosquito. And somebody talked about tetanus vaccine. It is a wound exposed to dust or rusted item. So we have, these are the common communicable diseases. Now, a bit about their prevention. You can easily know that what level of primary prevention can be done? Anybody, to prevent these communicable disease?
Vaccination.
So yes, it is a specific protection. You are correct. So that will be, so fortunately we have, just to increase, we have a cholera vaccine, we have a typhoid vaccine, we have hepatitis A vaccine, we have influenza vaccine, we have tuberculosis vaccine, the malarial vaccine has, we have come up with malaria vaccine, but not in India yet. It is, the trials are over in Africa, and we have a tetanus vaccine. So it is specific intervention. What could be the health promotion activities?
Sir, hygiene and sanitation.
Hygienic food. Yeah, hygiene and food, proper sanitation, proper water
Free from
supply.
contamination. Yes, sir.
So if we go for the primary prevention, health promotion will include good diet, proper nutrition, self sanitation. All these things are important. And as somebody rightly pointed out, the vaccination. And luckily, all the 7 diseases, we have vaccines available. Okay, so this is this. Now, just a word about the mosquito prevention.
Sir, I have a question.
Yeah, please, sir.
सर ये जो लिस्ट आप अभी जो प्रीवियस स्लाइड में दिखाई आपने, इसमें क्या यही है जो कम्युनिकेबल डिसीज है? इनके अलावा भी तो हो सकता है?
ना, मैंने तो सर एग्जांपल दिया।
अच्छा,
इसके अलावा बहुत सी हैं सर, डायरिया हैं,
HIV है।
सर रेबीज, दैट इज हाइड्रोफोबिया।
हाँ, रेबीज भी है सर, उसकी भी वैक्सीन है सर।
ठीक है सर।
सर ये सिर्फ हमने एक एग्जाम्पल दिया है ना सर?
ओके सर।
बहुत सी, मतलब आप खुद सोचिए, मतलब कम से कम 100 बीमारियां तो हम लोग गिना ही सकते हैं, अभी हम ही लोग आपस में गिना सकते हैं। ये थोड़ी सी ज्यादा कॉमन बीमारी है ना? मलेरिया है, डेंगू है, इन्फ्लुएंजा है, ये सब थोड़ी सी ज्यादा कॉमन बीमारियां है ना सर? वरना बीमारियां तो बहुत है ना?
ओके सर।
ठीक, थैंक यू फॉर आस्किंग। नाउ जस्ट can we just enumerate the diseases which are spread through mosquito bite?
Yes sir, malaria,
Malaria, dengue,
Dengue, sir.
dengue, yeah,
चिकनगुनिया
chikungunya,
Filaria.
malaria. So we know so many diseases. Now, you know, for every disease, we have different types of mosquito which are spreading the disease. Like for dengue, we have Aedes aegypti.
aegypti.
Yeah. But if we follow these 5 Ds, we can somehow prevent the mosquito-borne diseases or vector-borne diseases. It is not a comprehensive list. It is just that we can follow these things, these measures. Okay. First is, we don't want to let the water stand or stagnate, because we all know that the stagnation of water is a source of breeding of mosquitoes. So we don't want dumping standing water. So what we want is, we periodically dump standing water. So this will lead us to less breeding places for the mosquitoes. So what are the places where water can stagnate in and around us?
Like water coolers.
Water coolers. Which water coolers, sir?
Water coolers like air water coolers.
Those desert coolers, है ना? You
Yes,
want to
desert.
say desert coolers, sir?
Yes, sir. Yes, sir.
Yeah. Okay.
Old tires.
Yeah. Old tires, which we are so fond of, we put it on our roofs. Yes.
Ponds, wells in villages.
Empty cans.
Yeah. Empty cans. Any place else?
Choked drainage systems.
Flower pots.
वो भी आएगा सर, वो भी आएगा। ये जो हमारे एसी के डक्ट्स होते हैं,
Actually, roofs of abandoned buildings.
yeah. So these are the places we have to look for. The other, which sir said, that regularly draining standing water sources like pet water dishes, water troughs, and pools. And we don't want our roofs to be choked with water. Now, the third thing is, we have to dress accordingly. So dressing, whenever we are doing some outdoor activity, we should wear long pants and long sleeve shirts, so that these mosquitoes don't bite us. Okay. The fourth thing is that one should use mosquito repellents, and most common is DEET. It is one of the most effective mosquito repellent. And remember the fifth point, which is more true for dengue, that this mosquito bites us usually at dawn or dusk. जब सूरज निकल रहा होता है या सूरज ढल रहा होता है. And I hope you will appreciate that this is the very time we are loosely dressed. Early morning, we usually wear shorts and sleeveless shirts or something like that, whether it is male or female. And when we come back from our colleges, usually we are wearing easy clothes. And this is the time we have to be prepared and wear long pants and long sleeves. Okay, so these are the few things which we can do to prevent mosquito, apart from using meshwork in our houses and using mosquito repellents for repelling the mosquito. And don't let water stagnate in and around our houses. So this is how we can prevent mosquito. Okay, now are we able to see this slide which is depicting our hand?
Yes, sir.
Yes, sir.
This slide tells us that germs are on our hands. Whether it is hepatitis A, which can cause jaundice and diarrhea, whether it is streptococcus, which can lead to sore throat, or Shigella, which can lead to bloody diarrhea, or Hemophilus, which can lead to septicemia. Anything wanted to say? Somebody wanted to say something? Okay. So these microbes are in our hand. And what can be done to prevent this? Hand washing. So I hope most of us know how to wash our hands. But if we can do this a 30-second exercise, it will be very good. So can we do it? You can just, I'm also doing, you also do it. It is 6 steps. Rub hands palm to palm. Then right palm over left dorsum with interlaced fingers, and then vice versa. Then palm to palm with fingers interlaced. Then the back of fingers. Then rotational rubbing of left thumb clasped in right palm. And then the opposite, the vice versa. And then lastly, rotational rubbing backwards and forwards with clasped fingers of right hand, left palm, and vice versa. These are 6 steps of 5 seconds each. You can increase the duration, but you should not decrease it to a lesser than 30 seconds. So this is hand washing, which COVID has taught us. Which has taught us. Yes, sir. Somebody is telling something.
सर जैसे गवर्नमेंट की जो स्कीम्स हैं हैंड वॉशिंग को लेकर के जो गाइडलाइंस है उन्होंने कहा कम से कम 2 मिनट तक हाथ धोने चाहिए. आपने जैसे कहा 30 सेकंड, मोर देन 30 सेकंड्स. लेकिन ऐसी एड्स चलाई जा रही हैं टीवी पे कि बंटी का साबुन स्लो है.
अरे सर, आपने तो मेरी मुंह की बात छीन ली सर. मतलब मुझे तो ऐसा लग रहा है जैसे आपने मेरा कोई पुरानी लेक्चर सुन रखा हो. यही मैं एग्जांपल
नहीं सर मैं फर्स्ट टाइम.
हाँ सर, मैं मजाक कर रहा हूँ सर. ये बिल्कुल सर गलत है. मैं यही अभी कहने जा रहा था, है ना. ये साबुन स्लो और ये कुछ नहीं होता है. ये मिनिमम 30. वो ऐड गलत हट गया. ऐड नहीं आता वो सर. वो ऐड हटा दिया गया इसीलिए, है ना.
काफी टाइम तक सर हम लोगों ने उसको देखा.
हाँ, एक ऐसे ही ऐड आता था मॉर्निंग आफ्टर पिल का, अगर याद हो. एक कॉन्ट्रासेप्टिव पिल थी, उसका ऐड आता था मॉर्निंग आफ्टर पिल. वो उसमें देखिए, ये जो मॉर्निंग आफ्टर पिल होती है, जो इमरजेंसी कॉन्ट्रासेप्टिव होते हैं, ये एक्सीडेंटल प्रेगनेंसीज को रोकने के लिए होते हैं. ये नॉर्मली ऐसा नहीं है कि यू आर नॉट यूजिंग कॉन्ट्रासेप्टिव एंड देन यू सब्जेक्ट द फीमेल टू यूज दोस कॉन्ट्रासेप्टिव्स. वो बहुत ही डेंजरस चीजें होती थी, तो उसके लिए भी बहुत लिखा गया और वो भी एड अब हटा दिया गया. तो बंटी वाला एड भी अब हट ही गया है. यूट्यूब से शायद ना हटा हो, लेकिन वैसे अब नहीं आता है सर. वो लाइफ बॉय का ही एड था. ना? तो बिल्कुल आपने सही कहा, है ना? ये मिनिमम है सर 30 सेकेंड्स, ठीक है ना सर? ओके, कोई और क्वेश्चन? आई होप
Sir, nail should be clipped regularly.
सर नेल्स मैडम बिल्कुल क्लिप होनी चाहिए। आपके अगर हाथ में अंगूठी है उसको हटा लेना चाहिए,
Yes,
है ना?
yes.
क्योंकि वहां से भी एक नाइडस हो सकता है। वो तो मैडम ऐसे भी आप हाथ धोए ना धोए, हमको नेल्स तो अपने नहीं बड़े होना चाहिए। पर्सनल हाइजीन इज वेरी इंपॉर्टेंट मैडम,
Yes.
है ना? सो यू नो, by merely washing our hands, there was a study 30 years back, 40 years back, by just washing hands, there was a reduction of diarrhea in a country by 30%. So you can easily imagine how far this is such a cost-effective method it is, hand washing. Now, when should we wash our hands? Anybody? When should we wash our hands?
Before eating.
Before eating. Thank you so much.
When we come from
But after coming from toilet.
Yeah. Whenever we are using washroom, before eating, before preparing food. Before preparing food. That is also very important. And then, yes. Okay. So, and especially if mother is a lactating mother, before feeding her child, she should wash her hand, and after cleaning the child also, she should wash the hand. Okay. So,
सर बाहर से जब आते हैं तब भी हाथ साफ करने चाहिए
जी,
बाहर से जब आते हैं सर घर में पूरे दिन के गए हुए वैसे ड्यूटी से शाम को तब भी सर हाथ साफ
अभी
करने
हाथ
चाहिए।
धोना चाहिए, बिल्कुल
सर
मदर
वैसे
कह दीजिए
किसी
कि अपना
किसी से हाथ मिलाने के बाद भी धो लेने चाहिए सर।
सर किसी कोई और डिस्टर्ब कर रहा है, उससे प्लीज रिक्वेस्ट कर दीजिए कि वो अपने को म्यूट कर ले, है ना? आई वुड बी एक्सट्रीमली थैंकफुल। कुछ लोग बेख्याली में अपना खोल लेते हैं, प्लीज उनसे कह दीजिए कि ऑफ कर ले, ठीक है? ओके,
इकरामुल हक जी अपना माइक ऑफ कीजिए।
थैंक यू सो मच, है ना? सो दिस इज दिस, व्हाट इज दिस?
do not handshake, sir.
हाँ, always if you are suffering from any respiratory disease, please don't offer a handshake. It is better to do Ram Ram from a distance. Okay, so that is a thing which this is. Can anybody tell me what is respiratory or cough etiquettes? What are cough etiquettes? Anybody?
Covering the mouth while coughing.
Yeah.
And sanitize.
Covering the mouth, how?
Mouth and nose both.
How?
With hand.
Tissue paper or hanky.
Clothes with hand or
Handkerchief.
elbow.
No, sir, not with our handkerchief. It has no, and not with our palm, but rather through our arm. अपने हाथ से करना है, हाथ से, palm से नहीं करना है ना? So this is how we have, and we don't have to spit indiscriminately. Now, this was all about communicable diseases in nutshell. The other problems are
Sir,
non-communicable diseases.
Sir,
Which-
what is the role?
Yes, please.
Sir, what is the role of the hand sanitizers which we use
They have a
while
good
on
role. They have a good role, ma'am. If you don't have water and soap, if you are traveling somewhere, or you are not able to have, you don't have access to water, clean water, you can use your hand sanitizers.
So they are equally effective.
Alcohol
They are
का
equally
percentage
they are
कितना होना
equally
चाहिए?
effective, but anything should not be used in excess. They are
इसमें जो
equally.
परसेंटेज लिखा होता है अल्कोहल का,
Pardon, sir?
सर अल्कोहल परसेंटेज
जी, है ना? देखिए,
सैनिटाइजर्स में।
देखिए अलग अलग अल्कोहल, अलग अलग सैनिटाइजर में अलग अलग आती है। अभी हम लोग कोविड में कितने % का यूज कर रहे थे?
सर याद नहीं है।
अरे इतनी जल्दी भूल गए सर? इतनी जल्दी 4 साल कहाँ हुए सर, अभी भी चल रहा है मामला। बस कितनी, कौन बताएगा कितने % अल्कोहल यूज कर रहे थे?
50% है सर।
70%.
बताया आपने?
70%.
70%
है ना? अभी तो देखिए सर ने तो बिल्कुल जिसे कहते हैं ना, कोविड को बिल्कुल भुला दिया, है ना? कोविड को देखिए 60% या उससे ऊपर जो होगा वो हमारे लिए कारगर होगा, है ना? 60% तो होना ही चाहिए, है ना? उससे अगर उससे कम होगा ना तो थोड़ा सा मतलब फायदा नहीं होगा,
फायदा नहीं होगा, उसकी फायदे वाली।
हम लोग बात करते हैं नॉन कम्युनिकेबल डिजीज की, इसको हम क्रोनिक डिजीज भी कहते हैं। ये यूजुअली नॉन इन्फेक्शियस होती हैं, बट रिमेंबर दे आर ऑफ इम्पोर्टेंट पब्लिक हेल्थ एंड many deaths are globally because of non-communicable diseases. The common non-communicable diseases are, they are basically 4 types. What are those? What are those diseases?
Cancer, chronic respiratory disease,
Cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes. And we have other diseases also, but these are the 4 main types of non-communicable diseases. And unfortunately, in India, we say that India is diabetic capital of the world. We have largest number of diabetes patients in India. So WHO list of most common and lifestyle diseases. These are all lifestyle diseases: cardiovascular diseases, diabetes, lung diseases, cancer. They are the most common top 4 lifestyle diseases, followed by asthma, ulcers, chronic kidney disease, and depressions and anxiety and stress. All these are lifestyle diseases. Now, when we are saying that they are lifestyle diseases, this means that they are amenable to prevention by changing our lifestyle. Anybody who can read it for me?
Yes, sir.
Yes, please, sir.
High blood pressure.
It is for non-communicable. These are the risk factors for non-communicable diseases. Yes, sir. Please.
These are high blood pressure, physical inactivity, obesity, raised cholesterol, decreased vegetable and fruit intake, raised blood glucose, alcohol, and tobacco use.
These are risk factors. Remember, I was talking about primary prevention, sir, and there I gave an example of overweight and obesity, and there we use 2 risk factors. So the same risk factors I'm using again. The examples are different. So for most of the non-communicable diseases, these are the risk factor. Aren't they related to our lifestyle? Yes, or
sir.
no?
Yes, sir.
Yes.
Yes, sir.
All are related to our lifestyle. So if we are able to change our lifestyle in a positive manner, then these non-communicable diseases can be curtailed to a higher extent. So we have to just do 3 things. We have to talk about dietary changes, physical activity, and cessation of use of tobacco and alcohol. These are the Three things which we should be concerned about, and let's take it one by one. Now, a healthy diet helps to protect against malnutrition of all forms, and especially diabetes, heart diseases, stroke, and cancer. Unhealthy diet and lack of physical activity are the leading global risk to health. Healthy dietary practices should start early in life. Breastfeeding fosters healthy growth and improves cognitive development, and have a long-term health benefits such as reducing the risk of becoming overweight or obese and developing non-communicable disease later in life. This is such an important thing, breastfeeding. Like, not only important to the lactating mothers, but to the newborn baby. So all these dietary practices should start early in the life. Now, what diet should be followed for the adults? We all are now, all these things are for us, whether it is you or me, it is for everyone. Now, a healthy diet should include fruit, vegetables, legumes, nuts, and whole grains. What is the quantity? At least 400 grams of fruit and vegetables per day. But it should not include potatoes and other starchy roots. ज़्यादा बता दिया हमने 400 ग्राम.
सर
सही है
ठीक तो है सर, सही है सर, 400 ग्राम
सही तो है सर. अच्छा, ये मैं नहीं बता रहा हूँ, इसका रेफरेंस है, WHO है ये, मैं मतलब इट्स नॉट मी हु इज टेलिंग यू. या मैम कुछ कहना चाह रही हैं? यस
सर, ICMR also has 2020.
मैम कुछ कहना चाह रही हैं ICMR का.
Yeah, sir, ICMR has also suggested to consume 150 gram of fruits and around more than 350 gram vegetables.
360 ग्राम,
यही है, वही सेम चीज है जो आप ICMR वाली कह रही हैं हमने. बिल्कुल. तो ये बताइए, जैसे हम कल की बात करें, यस्टरडे की, है ना, कितने लोगों ने इस चीज को किया था? सोच लीजिए और फिर बताइए. हम
सबने किया सर.
सर मेजर तो नहीं किया,
अंदाज से सर. बिल्कुल सही कह रहे हैं
सर.
नहीं किया,
I am frugivorous.
अच्छा, बट मैडम फ्रूटिवोरस अलग चीज होती है. इसके अंदर दो चीजें हैं मैडम, फ्रूट्स, वेजिटेबल्स, लेग्यूम्स, नट्स एंड होल ग्रेन्स, है ना. तो एक चीज और बता दें, सिर्फ फ्रूट्स खाना और बाकी चीजें ना खाना भी उतना फायदेमंद नहीं होता है मैडम, है ना. तो क्या हम लोग 400 ग्राम ले सकते हैं कि नहीं ले सकते हैं? Even if you are a meat eater, you can include vegetables in meat. Okay? The other thing, अब थोड़ा सा, ये तो जनरल था, less than 10% of the total energy, less than 10% of the total energy intake from free sugars. For example, if we are taking 2000 calories per day, not more than 200 calories should be from free sugars. Now, what are these free sugars? Any sugar which is added to foods or drinks, like sugars also present in honey, syrups, fruit juices, and fruit juice concentrates. तो हम सोचें हम दिन भर में क्या खाते हैं. सबसे ज्यादा जो हम शुगर कंज्यूम कर लेते हैं वो टी से या कॉफी से कर लेते हैं, है ना, या फिर हमने कोई स्वीट खाई. इन सारी चीजों में शुगर होती है, इसे कहते हैं फ्री शुगर। फ्री शुगर वो होती है विच इज एडेड टू द फूड्स और ड्रिंक्स, चाहे while cooking or while manufacturing, है ना? So these are free sugars. So we have to curtail this to less than 10% of the total energy intake, whatever we have. Okay, so this is equally. Yes, sir.
सर मैं ये कहना चाह रहा हूँ, क्या गेहूं में और आलू में ये भी शुगर होती है सर? क्या
कार्बोहाइड्रेट
लोग
होता
कहते
है
हैं किसी भी कुछ भी खाओ। जी जी सर।
सर कार्बोहाइड्रेट होता है,
इसमें शुगर होती है सर? क्या
हाँ सर,
आदमी क्या क्या
बिल्कुल
खाएगा फिर आदमी? सर ये तो रोजमर्रा की चीज है सर, ये तो खानी है डेली आदमी को।
सर आप फिर से मेरी बात को पे ध्यान दीजिए।
जी जी
फ्री शुगर्स आर ऑल शुगर्स एडेड टू फूड्स, जो हम ऐड कर रहे हैं अलग
जी,
से।
अच्छा,
मेरी बात
जी,
समझ रहे हैं सर आप?
जी सर जी
हमने वो तो इनबिल्ट है सर,
जी सर।
वो वीट में, राइस में,
यस
पल्सेस में,
जी
सब में सर होती है। अब देखिए, मैं बहुत ज्यादा डिटेल में इस टाइम नहीं जाना चाह रहा हूँ, इसमें
जी
बहुत
जी
से
सर
लोग ऐसे भी हैं
जी
जो मतलब दे मस्ट बी सम फ्रॉम न्यूट्रिशनल साइंस और बायोलॉजी बैकग्राउंड। मैं एक जनरल बात कह रहा हूँ सर। हर खाद्य पदार्थ में हर चीज होती है। फैट भी होता है वीट में,
जी जी
प्रोटीन भी होता है वीट में, है ना? सब होता है ना?
जी।
तो हम बात कर रहे हैं सर यहाँ पे फ्री शुगर्स की। जैसे चीनी, जैसे
जी
हमने
सर।
शक्कर, जैसे हमने शरबत बनाया है ना, उसका हम सिरप बना लिया कोई हमने,
जी
है ना, उसमें हमने शक्कर घोल ली, या हमने हनी डाल लिया अलग से, है ना, मैं उसकी बात कर रहा हूँ। या हमने फ्रूट जूस पिया, ठीक है सर? आपका क्वेश्चन बहुत अच्छा क्वेश्चन था, ठीक है सर?
जी सर।
नेक्स्ट,
थैंक
शुगर की बात हो गई। लेस देन 30% ऑफ द टोटल एनर्जी इनटेक फ्रॉम फैट्स। तो जो भी हम फैट कंज्यूम करें, जो टोटल एनर्जी है उसके 30% एनर्जी उससे मिलनी चाहिए, उससे ज्यादा नहीं मिलनी चाहिए। मतलब अगर हम 2000 किलो कैलोरीज फॉर एग्जाम्पल ले रहे हैं, तो 30% कितना हुआ उसका? 600 किलो कैलोरीज। उससे ज्यादा फैट हमको नहीं लेना चाहिए। एक एग्जाम्पल यहीं पे बता दूं, 1 ग्राम फैट तकरीबन 9 किलो कैलोरीज देता है। तो अगर हमने अपने पराठे में 1 चम्मच घी लगाया, तो समवेयर अराउंड 45 टू 50 किलो कैलोरीज हमको मिल जाती है, ठीक है? तो अब फैट, अनसैचुरेटेड फैट शुड बी मोर। और फ्रॉम वेयर डू वी गेट अनसैचुरेटेड फैट्स? फिश, नट्स, सनफ्लावर, सोयाबीन, कैनोला, olive oil. These are the sources of unsaturated fats, which should be preferred over saturated fats. What are saturated fats? Which are found in meat, butter, coconut oil, cream, cheese, ghee. All these are saturated fats. So we should avoid them. We should prefer unsaturated fats. And remember, there are other types of fats also called as trans fat, which is found in baked and fried foods, biscuits, cookies, cooking oils. They all have trans fats, which have to be avoided. ओवरऑल फैट 30% नहीं होना चाहिए एनर्जी, और उसमें भी प्रेफरेबली अनसैचुरेटेड फैट्स हमको डाइट में लेना चाहिए, है ना? तो अगर आप अनसैचुरेटेड फैट्स ले रहे हैं तो बेटर है, और सैचुरेटेड फैट्स 10% से ज्यादा तो बिल्कुल भी नहीं होना चाहिए, और ट्रांस फैट 1% से ज्यादा नहीं होना चाहिए। So this is about fats. Salt, it should be around 5 gram per day. That is 1 teaspoon per day. And preferably it should be an iodized salt. This salt should have iodine in it. So I talked about how much we have to take, how much curtailment of sugar, fat, and salt. Now, practical advice on maintaining a healthy diet. So, if we are eating at least 400 grams of fruits and vegetables per day, it reduces the risk of non-communicable diseases. How can it be improved? Always include vegetables in meals. Always. Eat fresh fruit and raw vegetables as snacks. How many of us eat vegetables and fruit as snacks?
I don't, sir.
हम लोग लेते हैं या पकौड़ियाँ खाते हैं या समोसा खाते हैं या सैंडविच खाते हैं?
No, sir. No, I don't.
Okay. So this is how you can improve your fruit and vegetable intake. How can you improve? By eating fresh fruit and vegetables as snacks. Now, the other, eating fresh fruits and vegetables that are in season and eating variety of fruits and vegetables. हमेशा prefer eating fruits that are in season. तो अभी हमारे सीजन में कौन कौन से फ्रूट्स हैं?
सेब, अंगूर,
Oranges.
अभी तो बेस्ट टाइम है.
अंगूर, केला,
Yeah. This is
संतरा, सर.
Sir, local fruits भी खाने चाहिए.
लोकल ही खाने चाहिए.
जैसे बेर.
लोकल ही खाना चाहिए, भी नहीं ही.
सीजनली फ्रूट सर.
हाँ, सीजनल और लोकल तो बहुत अच्छी चीज होगी क्योंकि वो फ्रेश मिलेगा आपको, है ना मैम? तो जी जी
सर,
वेजिटेबल के बारे में जैसे बोला जाता है कि जैसे पेस्टिसाइड काफी यूज होते हैं आजकल वेजिटेबल के लिए ना, तो उसका क्या इलाज है सर? जैसे हम लोग कोशिश करते हैं को जो काटने हैं उसको वाइल्ड वाटर में कुछ देर के, क्या ये ठीक है करना सर?
सर अब इस पे तो जितना हम लोग बात करें उतना कम है
जी.
देखिए, ये तो इसके लिए तो हम और आप तो बहुत कुछ नहीं कर सकते. ये तो फार्मर्स को हमें क्या कहते हैं जागरूक बनाना होगा, क्योंकि है ना, बिकॉज यू नो दिस इज द अदर साइड. बट वॉश द वेजिटेबल्स प्रॉपरली बिफोर ईटिंग, है ना.
गर्म पानी अंदर करते हैं 10-15 मिनट के लिए डिप करके, ठीक है सर? क्या वो
बिल्कुल लोग करते हैं, गुनगुने पानी में करते हैं, सब करते हैं, लेकिन है तो प्रॉब्लम सर. बिल्कुल आप सही कह रहे हैं, प्रॉब्लम है. मिल्क में भी प्रॉब्लम है. देखिए, काउस को, बफलोस को ऑक्सीटोसिन का इंजेक्शन लगाया जाता है मिल्क प्रोडक्शन इंक्रीज करने के लिए. वो एक हार्मोन है, वो भी हमारी बॉडी में आता है ना. अब प्रॉब्लम सर ये है कि ना, दिस इज बियॉन्ड द स्कोप ऑफ दिस डिस्कशन. लेकिन ये आप भी यहीं रह रहे हैं, हम भी यहीं रह रहे हैं, क्या कर सकते हैं सर, है ना. ये तो इंसान की ग्रीड है, कभी कभी मजबूरी भी हो जाती है ना. तो साइंटिस्ट को ऐसे तरीके, खास तौर पे एग्रीकल्चरल साइंटिस्ट, दे शुड कम अप विथ सम पेस्टिसाइड्स और इंसेक्टिसाइड्स व्हिच आर हर्बल. हाँ, है ना सर. तो दिस इज वन थिंग. ओके. फैट्स, replacing both saturated fats and trans fats with unsaturated fats, especially the polyunsaturated fats. So how can we do it? Steaming or boiling instead of frying when cooking. Replacing butter and ghee with oils rich in PUFA, that is polyunsaturated fats, such as soya bean, safflower, sunflower. All these things can be done. Eating reduced fat dairy products, limiting the consumption of baked and fried foods and pre-packaged foods. Now, this can be done easily. So I'm not saying that don't eat cookies, don't eat cakes. I'm not saying that. Limit the consumption. Limit it. It should be occasional. It should not be that one is daily having biscuits and cookies and all other things. And we can change our cooking pattern, like steaming or boiling instead of frying when cooking. So this can lead to decreased fat intake. Salt intake should be reduced. So can you see the food items which are rich in salt? Gravies, soya sauce, pickles, pizzas, they are rich in salt. So one should avoid this and also use potassium-rich food, which mitigates the negative effects of high sodium consumption. So can you name some high potassium-rich food?
Banana.
Banana, guava,
Coconut
आमला,
water.
कोकोनट आमला, है ना, ORS, है ना, oral rehydration solution, they are rich in potassium.
सर ये जो सेंधा नमक इज सर पोटेशियम क्लोराइड और सोडियम क्लोराइड?
देखिए सेंधा नमक जो होता है नमक ही होता है ना, नमक का मतलब ही सोडियम क्लोराइड होता है सर, है ना.
ओके सर, समथिंग सम पीपल सेज दैट इट इज पोटेशियम क्लोराइड.
देखिए सर मैं आपको बताऊं, सॉल्ट का मतलब क्या होता है. वो याद है वो तारक मेहता में एक बार बबीता जी मंगाती हैं सोडियम क्लोराइड, जेठा जी पूछते हैं कि क्या है सोडियम क्लोराइड, है ना. तो सॉल्ट इज सोडियम क्लोराइड सर. बट व्हाट हियर आई एम ट्राइंग टू टेल यू इज दैट कि अगर सॉल्ट को इफेक्ट को मिटिगेट करना है तो हम पोटेशियम भी यूज कर सकते हैं. तो पोटेशियम रिच फूड्स के बारे में भी हम लोगों ने बात की. वो कौन कौन से थे? गुआवा, बनाना, आमला. These are, and somebody also said about coconut water. So
thank you.
We can use these things also to mitigate the effect of salt intake. Salt जरूरी होता है, ऐसा नहीं है कि salt बिल्कुल खत्म कर देना है. It should be less than 5 grams per day. Okay. Eating fresh fruits and raw vegetables as snacks instead of sugary snacks. We should avoid this. Now, what are the, अब देखिए दो चीजें मैडम हम लोगों ने बात कर ली सर. फूड कैसा लेना है, ठीक है ना. तो कोई हमको बता सकता है कैसा फूड हमको खाना है, उसकी क्वांटिटी और क्वालिटी? एनीबडी हु कैन जस्ट रीविजिट फॉर मी?
सर डाइट से मेरा एक क्वेश्चन था.
बैलेंस डाइट.
पहले सर मेरे क्वेश्चन का आंसर दीजिए.
बैलेंस डाइट.
बैलेंस डाइट में क्या था मैडम?
सर सीरियल्स एंड मिलेट्स, पल्सेस एंड लेग्यूम्स.
वो वाली नहीं, हमको प्रैक्टिकल बात करनी है.
यस सर.
फ्रूट्स एंड वेजिटेबल्स 400 ग्राम पर डे at least.
Yes sir.
Free sugars less than 10%.
10%. Sir,
30% of the energy should not more than 30% of energy should not be from fat. Avoid saturated fats and trans fats. फिर मैंने आपको एग्जाम्पल्स बताए किसमें होता है, तो उन चीजों को हमें लिमिट कर देना है. सॉल्ट नॉट मोर देन 5 ग्राम पर डे, है ना. ये चीज हम देखिए, वो डेफिनेशन अपनी जगह बिल्कुल सही है, ठीक है. तो ये चीज हमको अपनी प्रैक्टिस में लाना है. अब एक सर का क्वेश्चन था डाइट पे, वो बताइए. क्वेश्चन पूछिए सर.
सर जो शुगर से रिलेटेड बात कर रहे थे हम लोग, तो सर क्या अगर हम शुगर को अपनी डेली लाइफ से कट कर दें तो क्या उससे इफेक्ट पड़ेगा हमारे जो ओबेसिटी को कंट्रोल करने में?
फ्री
या वेट मैनेजमेंट में?
फ्री
लेकिन सर
फ्री शुगर्स को
सर मैंने एक वीडियो देखी थी, शायद आप लोगों ने देखी होगी सर। 2 कॉन्फ्लिक्ट है। एक तो जॉन इब्राहिम है, उन्होंने कहा मैंने 20 साल से काजू कतली यानी कि शुगर नहीं खाया है, काजू कतली नहीं खाई।
हाँ।
और दूसरा है विद्युत जामवार का, दोनों सर बढ़िया मतलब फिटनेस इन्फ्लुएंसर हैं। उन्होंने कहा कि आप जो खाते हैं डेली वो खाइए, अगर आप शुगर नहीं लेंगे तो आपका ब्रेन वर्क नहीं करेगा। तो इन दोनों में सर सही क्या है?
सर देखिए, अगर आप एक सवा घंटा हो गया सर हम लोगों को आपस में बात करते हुए, हमने एक वर्ड शुरू से कहा मॉडरेशन। और जो आप कह रहे हैं ना ग्लूकोज इज अ डाइट फॉर ब्रेन, ये तो सच बात है। यहाँ पे सर बात हो रही है कर्टेलिंग फ्री शुगर्स। सर आप जो फ्रूट खाते हैं उसमें शुगर होती है, खाइए। आप जो व्हीट लेते हैं, राइस लेते हैं, मॉडरेट अमाउंट में आप लीजिए, इसमें शुगर होती है। आप वेजिटेबल्स खाएं, देखिए सब हर चीज मेटाबोलाइज होके शुगर ही बनती है, ठीक है ना। वो बनती कार्बोहाइड्रेट, वो शुगर ही बनती है, टूट के ग्लूकोज ही बनता है वो, है ना। कुछ एकदम से ब्लड शुगर बढ़ा देती हैं जिसका हाई ग्लाइसेमिक इंडेक्स होता है ना। कुछ का धीमे धीमे होता है। तो जो धीमे धीमे ब्लड में रिलीज होती हैं वो बेनिफिशियल होती हैं। और ये जो फ्री शुगर है ये सिर्फ एनर्जी देती है और मोटापे को बढ़ाती हैं, इसलिए इसको कम लेने के लिए कहा गया है सर। वो भी हमने आपसे ये नहीं कहा मत लीजिए, कम लीजिए, नॉट मोर देन 10% ऑफ द कैलोरीज, ठीक है सर। तो बिल्कुल आप खत्म मत कर दीजिए, है ना। जीवन में से मिठाई मत हटा दीजिए, है ना। मिठास तो जरूरी है जीवन के लिए ना, लेकिन बहुत ज्यादा मिठास भी नहीं होनी चाहिए, ठीक है सर। तो मॉडरेशन की बात हो रही है। तो ये हकीकत है सर कि हमको जी कुछ कह रहे हैं? ओके, ठीक। अब बहुत जल्दी से फिजिकल एक्टिविटी के बारे में बात कर लें। पहले तो देखिए फायदे देखिए, है ना। इफ यू आर एबल टू सी इट, रेगुलर फिजिकल एक्टिविटी रिड्यूसेस योर रिस्क ऑफ ऑल कॉजेज ऑफ मॉर्टेलिटी बाय 30%। जितनी भी मौतें होती हैं उसको हम 30% रिड्यूस कर सकते हैं फिजिकल एक्टिविटी से। कार्डियोवैस्कुलर डिजीजेस बाय 35%, diabetes type 2 by 40%, colon and breast cancer by 30 and 20%, depression by up to 30%, hip fracture by 68%, और गजनी नहीं बनेंगे by 30%, that is dementia. Can you see the immense benefit of physical activity in our life? Everything can be controlled if we are having a good physical activity. How much physical activity should one do? हम लोग 19 to 64 year age group में आते हैं. So our aim should be at least 150 minutes of moderate intensity activity. हम कितना कह रहे हैं? 150 मिनट्स पर वीक, पर डे नहीं, 150 मिनट्स पर वीक। और यारी बात मॉडरेट एक्टिविटी, अभी हम बताएंगे मॉडरेट एक्टिविटी क्या होती है। दूसरी चीज क्या करनी है, ऑल एडल्ट्स शुड अंडरटेक मसल स्ट्रेंथनिंग एक्टिविटी। मसल स्ट्रेंथनिंग एक्टिविटी के एग्जांपल क्या है? कैरिंग हेवी शॉपिंग, खूब शॉपिंग कीजिए, है ना। अपनी मिसेस को लेके जाइए, अपने स्पाउस को लेके जाइए और उस शॉपिंग बैग को कैरी कीजिए, है ना। योगा, एक्सरसाइजिंग विद वेट्स, है ना। बहुत हैवी वेट नहीं इस्तेमाल करना है, अराउंड लेस देन 20 किलोग्राम से ज्यादा नहीं उठाना है। एटलीस्ट 2 days a week। कितने दिन करना है? जस्ट 2 days a week। And most importantly, minimize the amount of time spent sitting for extended periods। बहुत देर तक के बैठना नहीं है। This is what your body needs from you. Physical activity, इसको कहते हैं adequate physical activity. समझ में आ रही बात? अब जल्दी से देख लें मॉडरेट और मॉडरेट इंटेंसिटी किसे कहते हैं? ब्रिस्क वॉकिंग को. तो अगर आप पूरे हफ्ते में 150 मिनट ब्रिस्क वॉकिंग कर रहे हैं, दैट इज मोर देन इनफ. डांसिंग, गार्डनिंग, स्पोर्ट्स विद चिल्ड्रन, वॉकिंग डोमेस्टिक एनिमल्स, है ना, और कैरिंग और मूविंग moderate loads less than 20 kilogram. These are all moderate intensity exercise. इसमें कोई ऐसी चीज है जो हम नहीं कर सकते? ब्रिस्क वॉकिंग हम कर सकते हैं अगर हमें कोई प्रॉब्लम नहीं है, कोई हेल्थ इश्यूज नहीं है, है ना. तो ये चीज हम लोग हाउस वर्क एंड डोमेस्टिक कोर्स, घर के काम करना, पोछा लगाना, झाड़ू लगाना, झाड़ू लो. एक मीम मैंने देखा था कि आपको अपना घर बड़ा लगने लगता है कि अगर आप पोछा लगाने लगे, तो वही छोटा घर आपको बड़ा लगने लगता है ना. तो वी कैन डू दिस. So this is what our body needs from us. This is what we can do. So ये सारे एग्जाम्पल हैं मॉडरेट फिजिकल एक्टिविटी के. ब्रिस्क वॉकिंग, गार्डनिंग, साइकिलिंग, स्विमिंग, डांसिंग, इनमें से कोई एक चीज आप पकड़ सकते हैं अपने लिए. इट इज अप टू यू, whatever you can choose. I cannot suggest you to do anything. So it is very important that one do is. And third is, so after physical activity, the third is smoking cessation. Leading preventable cause of disease, disability and death. So lastly, it's not that diabetes, heart disease and obesity run in your family. It's that no one runs in your family. So this is the thing. I hope we were able to, we will be able to practice what we have discussed today, and hopefully we will have a happy and long life. So thank you so much.
Correct.
And we will break now. Thank you so much for your kind attention.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you, sir.
जी आप गोलगप्पे खा लीजिए.
थैंक यू सर. अमित जी गोलगप्पा खाएंगे?
हाँ बोल रहे वो बच गया.
Sir, that is not listed.
गोलगप्पा खाते को मेंशन नहीं किया.
दिखाई नहीं दे रहे.
गोलगप्पा खाते होंगे सर. गोलगप्पा खा रहे हैं, चुपके से स्लाइड से हटा दिया उसको.
गोलगप्पा से कुछ नहीं होगा सर. पिज्जा, बर्गर, बिस्किट ये सब नहीं खाना है.
अरे आप खुद फल खाइए,
कुछ नहीं होगा.
आप खुद फल खाइए, हम लोगों को ये सब लाइए, हम समझ रहे हैं.
गुड मॉर्निंग सर.
सर आ गया.
गुड मॉर्निंग.
हिंदुस्तानी है, हिंदुस्तानी से जब तक स्ट्रीट फूड नहीं खाएगा तब तक मजा नहीं आएगा. क्योंकि जब पहुंचेगी स्ट्रीट फूड की है, जब तक मजा नहीं आएगा. पेट हमारा काम ही नहीं करता बगैर गंदगी पहुंचे.
बढ़ जाता है.
यही स्ट्रीट फूड में हमारी इम्यूनिटी बनाए हुए
चाहिए सर अभी तो.